colleagues, welcome to the Global Coalition to Address Synthetic Drug Threats. This is Working Group 3, September 6, 2024 session. I want to start off, as this is our last meeting and our last hour of over 150 hours of coalition meetings over the past year, by thanking our INL team that's been working diligently on the coalition, Sarah Finmore and Bill McGlynn, the full-time partners, along with the broader INL team, the technical moderators, Henki, Cyril, Connie, and all of the interpreters, State Language Services, and Patrick Tapia as well, to our co-chairs and to our international organization coordinators. It's been quite an enriching experience. I have a few administrative announcements to get us started, and then we will begin our session for today. First, I want to highlight that while this is our final working group meeting, this is not the end of the coalition. We're going to begin in October with year 2, and we are moving from a phase of design and development to operationalization. So today, the co-chairs of the working groups and sub-working groups will take stock of what has transpired, and they'll provide a vision for the future. We just heard in the second hour the director of EUDA, Alexis Gusdale, who also shared with us the developments within the European region. So what's next over the next few months? In a few weeks, we will celebrate a special side event at the UN General Assembly, and I will speak to you about that. Toward the end of the year, we will be releasing a Year 1 report. We will have several regional events in the calendar over the coming months, and we will begin our lines of action and meetings of interested organizations. So if you are interested in any of the lines of actions that we will begin designing and developing, we encourage you to begin joining those as well. Now, about the United Nations General Assembly event. On the margins of the 79th UN General Assembly High-Level Week in New York City, the United States will host a side event for the Global Coalition to recognize the work accomplished to date by the coalition and mobilize further action to tackle synthetic drug threats. To demonstrate the importance the United States places on this issue, President Biden intends to host this event. With that in mind, we are seeking participation from heads of state from countries participating in the coalition and encourage countries to send their highest representative to participate in the event. Invitations will go out shortly once we finalize the event's date and time. And with the invitation, we will circulate a pledge for countries to take actions within their own jurisdictions. We hope that this pledge is something that your countries can support. And now I will read the pledge verbatim, word for word, for the benefit of interpretation. Launched in July 2023, the Global Coalition to Address Synthetic Drug Threats is an international effort to counter the global threat posed by synthetic drugs like fentanyl. Under the auspices of the coalition, over 150 countries and international organizations have joined forces to disrupt the illicit production, distribution, and sale of synthetic drugs and their precursors and the criminal networks that traffic these drugs, detect emerging drug threats, and promote public health interventions to prevent and reduce illicit drug use and associated health-related problems. In order to further these efforts, we, the following undersigned coalition members, pledge to take the following actions within our own jurisdictions. 1. To regulate all synthetic drugs and precursor chemicals placed under international control by the United Nations Commission on Narcotic Drugs. 2. To review relevant policies, regulatory, and legal authorities, identify gaps that impede the effort to effectively address the synthetic drug threat, and take appropriate actions to close those gaps. 3. To expand public-private partnerships in the ongoing work to secure supply chains and disrupt drug trafficking, including by encouraging, know your customer best practices, and protecting against illicit activity within the chemical, pharmaceutical, shipping, consignment mail, social media, and financial sectors. 4, to share relevant information regarding suspicious shipments or trafficking of drugs with the appropriate international and regional entities. 5, to develop and expand mechanisms to monitor real-time data on trends in illicit drug use and commit to share that data as appropriate regionally and internationally. 6, to expand quality, access, and availability to treatment and other public health measures, including overdose prevention medication, to protect against drug-related illnesses and deaths, and expand training for the public health workforce addressing substance use. And 7, to support as appropriate international capacity building efforts consistent with available resources and authorities. If you would like a copy of what I just read, you can find it by logging into the website and then going to the posts that I have made in each of the sub-working groups. So what's left to accomplish over the coming months? We will be looking at 3 pillars, as we've discussed in last month's meeting. We will be having collective meetings. Those are a donors conference so that donor countries can compare notes in terms of what they have been supporting and intend to support in the drug control system. A thought leaders conference taking place early next year to bring together brilliant minds and help forecast where the drug trends are going over the coming years. Regional meetings that will be organized by international organizations to discuss the unique dynamics of each region and sub-region, and then concrete lines of action. Those are very specific plans and strategies and activities that will take place over the coming year. Now, one thing very important, on the website, you will see that the link for, or the section for the meeting schedule has been replaced with upcoming events, as you see there on the screen. I encourage you to consult with this page regularly. If you go now to that page, you will see that we have several events that have already been listed. These are coalition events. And if you are interested in participating or make sure that your country is participating, you'll notice that we also have email addresses associated. In the future, we'll have different lines of action and their activities on this page. So if there's a training, a workshop, a webinar, an event, you will see that there will be a registration link or registration form that you can access through this page. So again, please check in regularly. That's one way of being able to keep up. You can also always email us, the INL team, at syntheticscoalition@state.gov, and we would be happy to answer any questions that you may have about any events or lines of action. So with that, I'm going to stop sharing my screen. And today's program or format, we will be going through the list of co-chairs and inviting them all to share the reflections and their ideas. So I'd like to start off first with Dr. Maria Corazon Dumlao from the Philippines to begin with sub-working group 3.1. Over to you, Dr. Dumlao.
Thank you, Bill, Brian, and esteemed officials of VSINL. I would also like to take this opportunity to thank our coordinators, Dr. Joe, Dr. Wadi, and of course to Sarah, Henki, and the rest of the technical administrators and support. It has always been memorable to be with our colleagues from 100 plus countries to highlight efforts on prevention in this laudable platform created by USINL. And of course, to also have joined the meeting of the co-chairs in Thessaloniki, Greece. Through this platform, several initiatives, best practices, and EBI interventions have been shared by different countries, highlighting challenges and lessons learned. For a year, we journeyed together, and as we close year 1, we are hopeful for year 2 that the efforts and momentum will be sustained. we have already the recommendations of the coalition, and on our end with the Ivana, we feel that it's always practical to share what we intend to do in our countries to translate, adopt, and integrate the recommendations, and of course, strengthen what we already have. And the other high level inputs and recommendations can be discussed in this platform. So I would like to share first my the presentation from the Philippines. Can I request Ma'am Sarah to share the video?
Yes, one moment.
Thank you, Ma'am Sarah.
For year 2 of the Global Coalition, we'll be aligning our efforts on substance use prevention in schools with the recommendation of the Global Coalition on Prevention. Our key initiatives are related to 3 areas: institutionalization, implementation, and implementers. As to those related to institutionalization, we will be integrating and aligning government efforts with national plans and platforms, such as those with the Dangerous Drugs Board, Philippine Anti-Illegal Drugs Strategy, or the PADS, the DepEd's Basic Education Development Plan 2030, particularly for the 4th pillar, resiliency and well-being, and the Operational Plan for Health, or OK sa DepEd, Healthy Learning Institutions, which is in partnership with the Department of Health. For institutionalization and sustainability of programs and advocacy efforts, we will be strengthening the National Drug Education Program, ensuring learners' meaningful participation through the Peers Against Drugs, scale up piloted EBI packages, and participate in the Global Coalition to address synthetic drug threats. For those related to implementation, we will strengthen enforcement of policies, guidelines, and standards. And here are the basic policies that needs to be enforced: those related to drug-free or preventive drug education policies, those related to the comprehensive policy on tobacco control, and those related to the schools as healthy settings. We will also mobilize resources for substance use prevention through international partners such as the USINL, Colombo Plan, UNODC, UNICEF, among others, and through local partners such as the Dangerous Drugs Board, ASEAN Training Center for Preventive Drug Education, Department of Health, Social Justice Philippines, among others. And we will continuously participate in research, monitoring, and evaluation. Some examples are participation in the DDB survey, Global Tobacco Use Survey, Global School Health Survey, among others. And we will also strengthen our initiatives related to implementers, such as addressing social stigma and discrimination through legislative advocacy, policy and programming, and reframing mindset. Here, we utilize the principles of UPC in our recommendations for legislative amendments, and also principles of UPC are highly considered in the formulation and implementation of policies and programs. And DepEd implements national and field rollout of UPC trainings along with efforts to professionalize prevention among NDEP coordinators. Those related to professionalizing the prevention workforce, we will continuously capacitate our NDEP focus on UPC and conduct various trainings on different aspects of prevention, and will support credentialing efforts. We now have 13 passers in the piloted February 2024 ICAP examination. The regional offices were downloaded funds for their respective regional rollouts of the UPC training, and We have 1,538 participants for UPC1 and 1,380 participants for UPC2. And these are also the central office-led UPC trainings. For the ways forward, we will strengthen the implementation of the Department of Education, DOH, OPLAN or Operational Plan for Healthy Learning Institutions, strengthen partnerships on substance use prevention, integrate and align efforts for substance use prevention, adolescent reproductive health, and school mental health, review and update policies related to substance use prevention, particularly for tobacco control, to include ENDS, and institutionalize after-school sports activities incorporating substance use prevention, and document best practices. Thank you very much.
So as I have shared, the first challenge is to be able to translate what we have learned in the process of engaging in the global coalition. We learned and grew, and it's already the time to show it in our own little area of responsibility, while looking for champions to spotlight what we already have in our specific countries. So I will now turn over the floor to my colleague Ivana for her presentation. Over to you, Ivana.
Okay, greetings from Seychelles. So I'll share my presentation first. I'm Ivana from Seychelles. Okay, can you all see it?
Yes, we can see it now. If we can put it in presentation mode, it would be great.
Okay, this is what I'm trying to do. Okay.
Perfect. Thank you.
Okay, like I say, I'm Ivana from the Seychelles. So just to put into context how the intervention for substance use started in the Seychelles. So it all started in 1994. At that time, there were 3 subcommittees that were formed: prevention, treatment, and law enforcement. And they were under the auspices of the Ministry of Employment and Social Affairs. The prevention committee was named Task Force Against Alcoholism and Drug Abuse. But then later on in 1997, the task force was renamed as Drug and Alcohol Council, better known as DAC. DAC then became the national body for all drug control programs and activities in Seychelles. So in 2017, there was the enactment of the Prevention and Drug Abuse Rehabilitation Act. And through the act, the Agency for Prevention of Drug Abuse and Rehabilitation was established, and the agency was better known as APDA. APDA was responsible for the prevention of substance use, treatment of people who use drugs, and rehabilitation of drug and alcohol-dependent persons. At that time, within the agency, we had a unit for prevention, we had unit for treatment, harm reduction, social reintegration, as well as a policy unit, and then a monitoring and evaluation unit. But in 2021, the APDA Act was repealed, and APDA became a division within the Ministry of Health. It was then named Division for Substance Abuse Prevention, Treatment, and Rehabilitation, better known as the DSAPTR. However, the functions of the division remain the same as it was for the agency. In terms of over the years, the international support and networking, we've had support from UNODC, especially UNODC. The support has many in terms of treatment, and then capacity building, especially for the supply reduction. But when APDA was in existence, we had their support for the development of the National Drug Control Master Plan. That was for 2019 to 2023. We've also had support from Colombo Plan. And Colombo Plan, the first sessions we had was in 2016. We had the prevention, at that time, it was the coordinator series. We had the UPC. So then we've had training for UTC as well. We've had other training for UPC training, but we've also had the training for UTC. We had the first group that was, that did the ICAP UTC credentialing exam last year. We've also had training support from WHO in terms of capacity building, and then the African Union as well, capacity building, and then SADC. In terms of what we want, what we aim to do for the coming year, moving forward, we're thinking of capacity building and partnership. So in terms of capacity building, we intend to have training for the Ministry of Health staff, healthcare agency, and the Public Health Authority. Maybe just to mention, I'm currently working in the Human Resource and Administration. So within the division, there is a unit for human resource development. So we are working together with BSAPTR, the prevention unit, where we hope to, we've already started the discussion. We will be having scheduled training. And like I mentioned, it's for the Ministry of Health staff. We also intend to have training for the Ministry of Education and private schools, Department of Social Affairs, and the Seychelles National Youth Council, SNYC. Capacity building for the Ministry of Health staff, we're thinking of encouraging in terms of the CPD, because the technical staff, those that are under the Medical and Dental Council, as well as the Nursing and Midwife Council, and then we have for other technical staff for the Allied Health Council, they have to renew their license every 2 years. And for the renewal of license, they have to show proof of CPD. So we're thinking of using the training for UPC to provide them with opportunities for training. And at the same time, this will maximize the Ministry of Health staff that are exposed to the UPC training. We intend to implement their knowledge, skills, so that they can put that in practice in their everyday life. So not only in terms of having project and program later on, but even in their family life and in their work, which will lead to more evidence-based or informed decision. So parallel to the training, the capacity building, then we intend to seek opportunities to establish projects with the relevant partners to ensure that whatever we're doing, then we can actually realize it in terms of within the country. So thank you very much. This is from me.
Thank you so much, Ivana. That was excellent. And as well as Dr. Dumlao, thank you. This was a really nice way to showcase how to do that local application of the coalition's kind of overarching kind of directions. So next, let me turn it to our co-chair from Sub-Working Group 3.3, Dr. Dawlet Bayatissov, who I see there on the screen. It's good to see you, sir. Over to you.
Добрый день, Брайан. Добрый день, уважаемые коллеги. Я очень рад участвовать. Что в течение года принимал участие в работе коалиции. Бесспорно, создание глобальной коалиции явилось своевременным, нужным сообществом в борьбе с угрозами синтетических наркотиков. Благодаря коалиции мы имеем возможность ознакомиться с различными подходами и передовым опытом государственных органов, неправительственных организаций, международных организаций, медицинского сообщества, правоохранительных органов, системы правосудия. Залогом успеха в борьбе с синтетическими наркотиками является консолидация усилий межведомственных взаимодействий и применение эффективных методов борьбы. Конечно, наши страны находятся на различных этапах в борьбе с угрозами синтетических наркотиков. И это обусловлено имеющимся потенциалом человеческих, финансовых ресурсов, вовлеченностью гражданского сообщества, политической воли. Несомненно, очень важно наличие в странах планов по борьбе с наркотиками, принятых на уровне правительства. К примеру, в Республике Казахстан имеется комплексный план по борьбе с наркоманией и наркобизнесом, рассчитанный на 3 года до 2025 года. Он утвержден постановлением правительства Казахстана и включает в себя 77 мероприятий, сгруппированных по 6 направлениям. И в реализации этих мероприятий участвуют 12 министерств и 20 муниципальных органов управления. Наш комплексный план пока не включает в себя мероприятия, касающиеся работы с населением, взаимодействующим с системой правосудия, включающие альтернативы тюремному заключению. Но мы будем теперь готовить эти предложения в следующий комплексный план на 26-28 годы, а пока мы будем проводить подготовительную работу. У меня есть несколько предложений по дальнейшей работе нашей коалиции, я хотел бы их озвучить. Во-первых, мы все знаем, что коалиции разработаны свыше 60 приоритетных направлений по вопросам борьбы с угрозами синтетических наркотиков. Каждое направление сформулировано в одном или двух предложениях. Но для повышения эффективности я предлагаю разработать универсальные методические рекомендации или руководство по реализации каждого конкретного направления. И это может стать отличной эффективной библиотекой, про которую говорил и Брайан, из которой страны смогут брать те или иные приоритетные направления и уже готовый инструмент по их внедрению в своей стране. Следующим шагом может быть создание группы международных экспертов, которые будут помогать в адаптации этих рекомендаций для конкретных стран. Потому что, как я уже говорил выше, мы все страны находятся на различных этапах развития и по уровню борьбы на различных ступенях. И очень важно вот эти все помочь каждой стране адаптировать реализацию конкретных приоритетных направлений, уже сформулированных конкретные планы и инструменты. Я также поддерживаю создание координационного совета глобальной коалиции, что позволит повысить эффективность проводимой работы во всех странах и способствовать реализации тех же приоритетных направлений. Считаю целесообразным создание региональных представительств глобальной коалиции, о которых говорили и предыдущие участники, выступающие, и рабочих групп 1 и 2. К примеру, различные страны, они могут объединены в единое представительство, которое имеет общие географические, похожие политические, экономические условия. К примеру, Центральноазиатский регион. Он включает в себя 5 стран, в которых проживает свыше 82 миллионов человек, имевших в прошлом похожие модели систем правосудия, здравоохранения, государственного управления. И именно вот эти региональные представительства, которые они могут именно координировать и усилить потенциал не только одной страны, а целого региона. Ну, в будущем, я думаю, что это, конечно, не сейчас, но мы можем подумать о разработке рейтинга стран по борьбе с угрозами синтетических наркотиков. Конечно, это очень сложная задача, но он может включать в себя несколько универсальных индикаторов, отражающих эффективность принимаемых мер. То есть, если мы ранжируем страны, мы будем понимать, на каком месте на сегодняшний день находится конкретная страна. И сопоставив через 2-3 года принимаемые усилия, мы поймем, насколько ступеней вверх продвинулась каждая страна в вопросах именно борьбы с синтетическими наркотиками. Большое спасибо за внимание.
Thank you. Thank you so much. Very much appreciate all of those comments. Now let's go to our final co-chair for tonight. We have Assistant Secretary Sean Starmer from the Australian Department for Foreign Affairs and Trade. Over to you, sir. Thank you.
Thank you very much, Brian. Thanks for the opportunity to speak, and good to see you and others again online. I'm going to start by making some acknowledgements. I think there's a tremendous amount of work that's gone into getting us to this stage. So acknowledging the work of co-chairs involved in this working group who've spoken today. I commend the US for its leadership on addressing the global synthetic drug threat through the Global Coalition, bringing together so many countries. It's a huge effort and a huge achievement, and I think it reflects the importance and the urgency of this issue. Commendations also to US colleagues on a personal note for their stamina tonight. I think it's very early in the morning your time, so that's no small personal sacrifice in order to keep this work going. I'll also take a moment to acknowledge the efforts of every member of the Global Coalition that's participated over the many discussions and meetings over the past year. We have a significant group of people online, but that's just a small share of the total effort. Getting a breadth of perspectives and best practices from around the globe are going to be an invaluable part of mapping the Coalition's path forward for year 2. Let me also take a minute to acknowledge the efforts of the United States, the UNODC, and other organisers to engage such a diverse range of speakers and presenters, including technical experts, ensuring that different experiences and those of different priority populations could be explored. We're all engaged in this working group because we think that public health-focused efforts and initiatives should remain absolutely at the forefront of our global response to the challenges posed by synthetic drugs. Australia, along with many other countries in a region, remains concerned about the synthetic drug use, about methamphetamines and amphetamine use in particular, in general. And we know that this problem is shared by many countries, including those in our immediate region in Southeast Asia and the Pacific. On this note, Australia has been exploring options with Australian researchers and the UNODC to engage in a scale-up initiative on treatments for stimulant use disorders. We've also seen the rise of potent novel synthetic opioids, which require coordinated and rapid responses to reduce associated harms. This includes through evidence-based interventions explored in Global Coalition discussions such as the naloxone programs and early warning systems. We're pleased to have been able to share Australia's experience with the sub-working groups over the past year, including on synthetic stimulant use disorder treatments, prompt response networks, take-home naloxone, alternatives to incarceration, and the monitoring and evaluation of drug policies. And we're looking forward to continuing to share our experiences and learnings with the international community through the Coalition and elsewhere. I'd also acknowledge the significant progress made on synthetic drugs since the second working group meeting in March of this year. There's been a sustained focus on synthetic drugs throughout the year's UN Commission on Narcotic Drugs, throughout side events, thematic discussions, and resolution negotiations. As a working group, we have settled on 49 recommendations across our work and working through the sub-working groups to deliver tangible outcomes during phase 3 of the Coalition. And the concerted efforts of all members to transition the Coalition's work and develop sustainable pathways as we head into year 2, including during the co-chairs meeting in Greece in June of this year. Australia welcomed the launch of the Global Recovery Network and the Global Women's Network at the Greece meeting. These are both initiatives that reflect the Coalition's ability to connect diverse stakeholders to develop treatment and recovery networks to have a lasting impact. It's going to be important that all Coalition members continue engaging and collaborating with the international community, including civil society organisations, to maintain the momentum we've been able to develop to date. Australia will continue its active engagement in combating illicit synthetic drugs, with a particular focus on Southeast Asia and the Pacific, as well as at multilateral levels through the Commission on Narcotic Drugs. And we'll continue to look for opportunities to increase cooperation on this issue in our region. We're looking forward to continuing to support the mission and the objectives of the Coalition into year 2 and beyond, sustaining the momentum that we've been able to build up over the past year and reflecting the work of this group by ensuring that prevention, treatment and recovery can be addressed in ways that balance health, law enforcement and human rights approaches and priorities, while also addressing the social determinants of health. Thank you very much.
Excellent. Thank you so much. That's music to my ears, because those are all of the points that we are constantly echoing. So it was wonderful summary of so many key findings, key lessons that we are all celebrating. I think what's whereas for supply reduction and for data collection, there's a lot to innovate and develop. One thing that gives me a lot of encouragement on the public health side is that we have so much evidence. There's so much science that we can rely on here. 70 years of empirical research in the substance use treatment field, harm reduction, 50 years in the drug prevention field. There's a lot of evidence-based practices. There's no need to reinvent the wheel, but we do need to take a systems approach, a person-centered approach. We need to make sure that what we're doing is really grounded in sort of the sort of that human rights and person-centered healthcare approach. So I would like to turn it over now to the floor. Any comments, questions, ideas in terms of ways forward? I've heard the interest in similarly looking at steering groups, something similar to what Working Group 1 mentioned, which is they had a really interesting methodology for year 2, which is to bring together leaders that would like to continue the discussions of identifying the concrete lines of effort. You know, we just heard, for example, as Mr. Starmer said, the stimulant use disorder track, where there's research that UNODC and WHO is conducting with test sites around the world. So that could be its own, and then sort of identifying those lines of effort and then finding champions to then help lead. And those champions could be governments, but they could also government officials. They could also be international organization staff and leaders and sort of program managers that could also lead these efforts as well. But let me open up the floor, see if there are thoughts and comments from the floor. Yes, Dr. Liabres, good to see you, please.
Good morning, good afternoon, good evening, everyone. I'm Dr. Bian Liabres from the Philippines, from the Department of Health Philippines. First and foremost, congratulations, Brian, for this very for accomplishing this first stage of the coalitions. You, together with INL and everybody, really put so much work into this, and really grateful for you putting this all together. Secondly, thank you to our speakers today, Dr. Dumlao, my colleague, Ivana Daulet, and Assistant Secretaries. I would like to say a few words with regards to the treatment and rehabilitation aspect. As was discussed by Ivana, they were already doing UPC, and I think it would be a good suggestion, I guess, to also include universal treatment curriculum learnings. It is available online, actually, and they can learn so much from that. It's a well-developed training program for the universal treatment curriculum. Secondly, also, we would like to share later on our algorithm for the continuum of care. We call it here in the Philippines the client flow for wellness and recovery from substance use involvement. It's actually more than just an algorithm for the continuum of care, but it's the development of how we were able to put a whole system of treatment and rehabilitation and recovery, which starts from general interventions, community-based programs, outpatient programs, inpatient programs, and all the way to scaling it up together with legislative lobbying and all of that. So it would be very helpful, I guess, for everyone, especially when we're doing the coalitions and more of the implementation plans. So that's all I would like to share. And again, congratulations, everyone, and thank you.
Thank you so much, Dr. Liabres, and very interested in the algorithm for the continuum of care. If you could share that on the coalition groups that we have, the 3.2 group, if you could post some information, we'd love to see and learn about that.
I will. Thank you so much.
Thank you. Let me turn it next. I see Ivana has her hand up. Please, Ivana.
Okay, thank you, Brian. Maybe just to add, actually, we've had training in terms of UTC. My presentation focused on prevention, but we've had training. This is why I said last year we had a first group of staff who did the ICAP credentialing exam for the UTC. And this year, the team from DSAPTR, they have already started some sessions with the Social Affairs Department. So there are work being done in terms of UTC, but my focus was on prevention because I come from a prevention perspective. Thank you.
Thank you. Thank you, Ivana. I'm also encouraged that we've been doing training for a long time, and we've been supporting training. I think the world has many have picked up the universal curriculum, and that's a curriculum that is updated with new additions every few years. Still, I feel that the scale of dissemination is challenging. It's challenging to expand that dissemination. Yes, now we have the curriculum online, and that's great. But I think that in this coming year, we want to see what strategies we could look to scale up to help better identify the workforce. And when it comes to the prevention field, it's so challenging to identify the workforce because people have their day-to-day jobs, and prevention is something they do, but you don't have as many full-time preventologists, if you will. You have teachers and community leaders and people working in the media field, and then they fall into prevention, and they don't auto-identify as prevention workers. So I think there's a sensitization campaign also. There is a lot of public awareness that has to take place. We often default right into, let's go right into the evidence-based practices. Let's build just go into sort of core media prevention. But public information has a role as well, sensitizing, building influencers and champions. And to that extent, I think it was said, I can't remember now if it was in this session or in the one for the West group, but the engagement of youth is something that I think we haven't done at scale, and we haven't done well enough. And that, I think, is one area that we really need to consider carefully. How do we engage today's youth? Because we say that, again, substance use is a disease that has onset in the pediatric years. Youth begin using drugs, and then the disease then takes hold and progresses. So engagement in youth and engagement across the different phases of what we would call youth. So adolescent years, how do we engage adolescents at scale? I don't mean a pilot in one country. I mean, how do we develop a global network of adolescents that are for health promotion and that are health conscious and that are looking at developing peer leadership skills? And then move that group into the progressive next step of university students that are now seeing careers and seeing their activism as a way of being influencers and through social media. And then move to the next network, which is a young professional network, where now we are building the next generation, the cadre of youth leaders that are now in the workforce and that are mentored by those here on the line that are experts in the prevention and treatment and recovery field. So that type of sort of continuum of development, I feel it's been done haphazard, and Ahmad had a very good point in focusing on sort of the need to kind of cultivate that youth prevention spirit when it comes to this issue, because there's a lot more that are pro health than are pro drugs, and I think we just need to mobilize some of that. But I see Bill has his hand up. Bill, I'll turn it over to you.
Thank you very much, Brian. And my rule is more to listen than to say anything in these meetings, but I am compelled to say how much I think the 4 leaders of these groups have contributed in their countries. Very briefly, I think on prevention, which I think requires a contact with people who have been engaged in it and adapting whatever curricula or system they're using to have contact with someone who's actually implemented it. And that for sure is true with the Philippines and Seychelles. And I think Dr. Maria Domlau and Ivana Tarasan have a deep experience in that. And I think sharing that and seeing how you've done that is just amazing. I also think Dr. Abay Pesov's ideas on how to provide a sort of a standard of where we're going and how we analyze what we do in this whole area is terrific. And of course, the ideas of trying to share that with other regional partners and, for that matter, partners outside the region. And finally, Assistant Secretary Starmer in Australia, they have just been basically everywhere trying to help move this forward. So again, I think you've given us all very specific ideas on how to move forward, and just to thank you for that. And we are all taking note and figuring out ways to support what you've suggested. Thank you.
Thank you, Bill. I see Dr. Dumla. Over to you.
Brian mentioned about the limitations of USINL, but on my end, I would like to highlight the strategy that USINL has been doing, the systems thinking approach, meaning that they supported the initiatives, but they put government at the center of the efforts, because it's only government who can really look into scale and into addressing the different challenges in a specific country. So I hope that can be highlighted, this initiative of putting government and strengthening the government is something, because like in our country, the USINL triggered the capacity building for professionals on prevention. However, the succeeding rollouts have been picked by government, particularly in our area in the Philippines. The Philippines has provided and institutionalized budgets for the capacity building of the focal persons for the National Drug Education Program. And it has also picked up the need to strengthen the youth. So the dangerous drugs for the initiated Peer Against Drugs, which has been adopted by the Department of Education. Now we have a group of peers nationwide. What can happen next is come up with toolkits that our UPC focal persons can use, and also toolkits and standard materials for advocacy that our peers can use. We also have a look at the problem on prevention at a very holistic approach, meaning we don't separate the issues on substance use with that of adolescent health, mental health. We look at the learner as a holistic well-being, holistic person, holistic human being with needs, developmental needs, and concepts should be age appropriate, and intervention should also be age appropriate. So I think that has to be highlighted. Yes, INL need not to look at scale, but it should be the government who will commit and provide resources with the support of all the partners providing technical support for those interventions. Thank you.
Oh, that's very encouraging. That's very excellent comments. And one thing that I think has been said, I think you said in an earlier meeting that also stuck with me when you said it, was, beyond, of course, we know we have to do a systems approach. We know we need to have the evidence-based practices and learn them, and the universal curriculum can help in that respect. But having a repository of the materials, of the tools, that toolkit that you mentioned, is so valuable. And that's an area where the Philippines can really contribute to the world, because you have so many materials that you've been developing, so many programs. I'm always blown away by how many things are being done in so many different settings. It's not one single program done in the entire country, but there's quite a richness and diversity. And I think there's several countries that have a good repository where there's been evidence, there's been research to say these are good interventions. My recommendation would be to try to centralize all of that in one place. I think ISUP as a town hall for the global community of the prevention, treatment, recovery, harm reduction workforce could be a good place to have a section where all of these materials are downloadable, and that they're downloadable, free of charge for governments and practitioners that would like to. Of course, we have to put some caveats on there, and there should be perhaps associated research to sort of instill confidence that these are materials that have been evaluated, because that could be a seemingly very large library of differentiated sort of quality of materials. But I think if we had some criteria, if there was some structure, having those materials would be very valuable. It's one of the requests that we receive the most. Is great to receive the UPC, but could we have, the 20 manuals, that we need to build a library, and do the exercises and such. So that's very helpful. Ahmad, I see your hand is up as well.
Thank you. Thank you. I would like to happy to share with you that the Colombo plants is also, have a training 8 to 13 for especially for the youth, engaging youth in prevention curriculum, international training for trainers, Asia and Africa. It's also, going. If we can see it now, we have lots of useful, if we can go to ISAP, each and everything's available there. So, we are also encouraging the university students and other students, they can join there. So, and secondly, my one question is, although we have in 2015, ISAP is created, now there are a lot, thousand members. So I want to know how we can, the global coalitions, even we have lots of members there, but we want to how we can, publish the more and more GDR professional health practitioners to join these coalitions. They will like this opportunity. There are lots of, materials regarding to drug demand reduction from young professionals as well as for the profession, they can avail these opportunities. So that's my point. Individually, we are, if it's possible, we can, sharing the social media. Yeah, if we can, sharing through ISAP, Colombo plants or other Kisira, that would be much better, more and more professional around the globe to join the global coalition. So thank you.
Thank you, Ahmad. Thus far, the Global Coalition has been focused on convening governments. In this next phase, where we start doing activities, the activities will engage private sectors, civil society, and others. And there will be sign-up forms to join the mailing list, where we will distinguish the different sectors that are participating. So certainly, we can have now sort of expanded participation beyond just the governments. I see Ivana also has her hand up.
Thank you.
Okay, thank you, Brian. I just want, before the session ends, I have to thank Colombo Plan for their continuous support and INL for the financial support, because in line with, existing the support prior, but in line with what we've said in terms of capacity building, we already have upcoming training. We have the core course that will happen later on this year, which will be followed by the family-based prevention course. And we're having the full support of Colombo Plan. So I just want to mention that. Thank you.
Hey, thank you, Ivana. In the moments that we have left, I do want to highlight one thing very important for our colleagues here on the line, especially if you're representing a government. I think the spirit and the mantra is that training is necessary and yet not enough for our national workforces. We need to validate knowledge and skills with examination and credentialing. You may call it certification, you may call it credentialing, but that validation of knowledge is so important in our field to make sure it's professionalized as any other medical field is. To that end, we've heard throughout the coalition presentations that there is a global credential for the addiction workforce in treatment and certification in prevention. And it's run by an organization called the Global Center for Certification and Credentialing, GCCC. So I would encourage those countries that have not participated in this network just yet to join, to identify a commissioner from your governments that would sit in a commission that has about 30 countries, because we are building toward reciprocity between the countries of this commission so that it benefits the workforce. There's a universality that we can agree on. And the second piece of that is for the individuals. The other is for the actual services. for the treatment programs in your countries that are accredited and then licensed by your governments or by private organizations, those agencies, those quality assurance agencies, are invited to join the global network that has been created called ICQ, the International Consortium for Quality Assurance Agencies. There is a universal seal that we heard of earlier in the year that has been developed. And I think one of the qualitative improvements that the coalition could really proudly kind of note as a big achievement would be to have a number of countries join ICQ and agree on the global quality seal for excellence in treatment provision. Because what that will do is then national authorities can not just provide the national license, they can also provide this international quality seal, and you could start identifying throughout the world a universal level of quality based on the international standards of treatment from UNODC and WHO. And it helps us then identify what is treatment and then what is not treatment. We know that there are a lot of violations of client rights and human rights around the world. In all countries we see these types of centers, we want to make sure that we are emphasizing those centers that meet the international standard as well. And developing this network of QA agencies, quality assurance agencies, is key. So I'd really encourage you all, governments, to help us identify the quality assurance agencies in your countries and have them join, and then join with the United States, the UK, other countries that are part of this network to make sure that we have that reciprocity, that recognition. Sarah, I see your hand is up.
Yes, just as I see the time coming to a close, I just want to give Brian an applause. I know everyone on the line feels it as well. Thanks, Brian, for championing this, putting so much work in. This has been a big effort, and this is our last working group, sub-working group for this first year of the coalition. So bravo, thank you for being the captain, taking us through this whole thing. Thanks, Brian.
Thank you so much, Sarah. That's very nice. And thank you all, colleagues. We have come to the end, to the last, we spoke to the last minute, and now we have to move into action. So we will be in contact with all of you on next steps, and we encourage you all to join as many of these lines of effort as you can moving forward, and very much appreciate all of your commitment to the Global Coalition. We've accomplished a lot and much more ahead. So thank you all so much. Have a wonderful day, everybody. Bye-bye. All right, colleagues, welcome to the Global Coalition to Address Synthetic Drug Threats. This is Working Group 3 meeting for the West region. My name is Brian Morales, and as I try to set up my slides here, I want to begin by thanking you all for your dedication to this process, to these meetings, to this activity, to this initiative. I want to thank our INL colleagues, first and foremost, Sarah Finmore and Bill McGlynn, for all of their work and support as the permanent Global Coalition team, along with myself over the past year, and the broader INL team that has supported. The technical moderators, Connie, Henke, Cyril, all of the interpreters, State Language Interpretation Services, and Patrick Tapia. This has been a big effort, and there are so many people to thank. But I want to start first and foremost in of course, thanking our team for that. I have some announcements I'd like to share with you all before we get started. I know we're a little bit behind. This is the final meeting of the Global Coalition working groups and sub-working groups, but it's not the end of the coalition. Today, we're going to be hearing the vision for the future. We're going to be hearing some reflections from the co-chairs. We have just heard a presentation from the director of the new European Union Drugs Agency, Alexis Gusteo. We're thrilled for the establishment of the new agency. And we have some big things coming up in 2024. A UN General Assembly site event, a year one report release toward the end of the year, regional events, and we are going to be looking at specific lines of action that we're going to be taking forward for all of your organizations to consider. On the General Assembly, on the margins of the 79th UN General Assembly High-Level Week, the United States will host a side event for the Global Coalition to recognize the work accomplished to date by the coalition and to mobilize further action to tackle synthetic drug threats. To demonstrate the importance the United States places on this issue, we anticipate President Biden will be hosting this event. With that in mind, we are seeking participation from heads of state from countries participating in the coalition and encourage countries to send their highest representative to participate in the event. Invitations will go out shortly once we finalize the event's date and time. With the invitations, we will circulate a pledge for countries to take actions within their own jurisdictions. We hope that this pledge is something that your countries can support. I want to read the text of the pledge very quickly so that we have the benefit of interpretation. Launched in July 2023, the Global Coalition to Address Synthetic Drug Threats is an international effort to counter the global threat posed by synthetic drugs like fentanyl. Under the auspices of the coalition, over 150 countries and international organizations have joined forces to disrupt the illicit production, distribution, and sale of synthetic drugs and their precursors and the criminal networks that traffic these drugs, detect emerging drug threats, and promote public health interventions to prevent and reduce illicit drug use and associated health-related problems. In order to further these efforts, we, the following undersigned coalition members, pledge to take the following actions within our own jurisdictions. 1, regulate all synthetic drugs and precursor chemicals placed under international control by the United Nations Commission on Narcotic Drugs. 2, review relevant policies, regulatory and legal authorities, identify gaps that impede the effort to effectively address the synthetic drug threat, and take appropriate actions to close those gaps. 3, expand public-private partnerships in the ongoing work to secure supply chains and disrupt drug trafficking, including by encouraging know your customer best practices and protecting against illegal activity with the chemical, pharmaceutical, shipping, consignment mail, social media, and financial sectors. 4, share relevant information regarding suspicious shipments or trafficking of drugs with the appropriate international and regional entities. 5, develop and expand mechanisms to monitor real-time data on trends in illicit drug use and commit to share that data as appropriate regionally and internationally. 6, expand quality, access, and availability to treatment and other public health measures, including overdose prevention medication, to protect against drug-related illnesses and deaths, and expand training for the public health workforce addressing substance use. 7, support as appropriate international capacity building efforts consistent with available resources and authorities. We hope you can all sign on to that at the UN General Assembly. If you would like a copy of this document, it's located when you sign into your portal on the coalition website. I have placed it under the different sub-working groups. Now, what's left to accomplish are the 3 areas of work that we discussed at last month's meeting. We will have collective meetings of the coalition moving forward, but they will be limited. We will have regional meetings as well, organized by regional organizations, and concrete lines of action as well. And we have a new section for the calendar called Upcoming Events. I encourage you all to consult that regularly and take a look at all of the different activities that we have planned. Lines of effort, places you can register and participate will also be placed on this calendar over the weeks and months to come. So please check in regularly with these. I thank you very much for your time. I'm going to stop sharing my screen, and I'm going to now turn it over to our co-chairs for the different sub-working groups and working groups. For sub-working group 3.1, Ingadora Sigfusdottir passes her regrets that she could not be with us today. but I see our other co-chair, Carolina Bruce Almada, is here with us. Caro, over to you. Thank you for joining us today.
Hola Brian, mucho gusto y hola a todos y a todas. Sí, lamentablemente Ingadora no nos pudo acompañar, pero estuvimos reunidas preparando esta reunión. Nos interesa profundamente plantear, insistir o profundizar lo que planteamos cuando nos reunimos en Tesalónica, ¿no? Que dice relación con poder articular, y esta reunión ha sido muy interesante en eso, articular el trabajo de los distintos grupos de la coalición, porque es impensado hacer prevención si no tenemos en consideración qué está pasando con los datos, qué nos están diciendo los datos, cómo podemos interpretar esos datos y cómo podemos generar datos localmente para tomar buenas decisiones. Y también he pensado hacer prevención desconociendo todos los temas legislativos y de control que si bien no están a cargo nuestro y no debieran estar nunca a cargo nuestro, sí tenemos que hacer una mirada integral, porque cuando trabajamos en las localidades, cuando trabajamos en los territorios, en los barrios, en las comunas, no podemos separar lo que pasa en esas relaciones, ¿no? En esas comunidades. Entonces, dicho eso, creemos interesante insistir y plantear el tema de la toma de decisiones basadas en datos que ojalá sean producidos localmente, y por eso las alianzas con los observatorios de los distintos países son fundamentales, pero también poder generar espacios de acompañamiento de acuerdo a los niveles de desarrollo que tienen los distintos países en la implementación de programas preventivos orientados, basados, informados en evidencia, ¿no? Algo pasa entre la decisión de implementar un programa basado en evidencia que tiene que estar fundada en datos locales eh, y los resultados. Y cuando decimos que algo pasa allí, es que no basta tomar buenas decisiones, sino que esas decisiones se tienen que acompañar, tienen que haber procesos de asesoría, tienen que haber procesos de reflexión. Tenemos que estar constantemente formando a los equipos y formándolos no solo en elementos conceptuales y metodológicos, sino también formándolos en la reflexión constante para la toma de decisiones, ¿sí? Las reflexiones el detenerse a pensar qué es lo que estamos haciendo cuando hacemos prevención basada en evidencia, no es solo el inicio en la selección del programa y no es solo al final para analizar los resultados, ¿no? Y en eso nos parece que los encuentros regionales que se proponen deben estar orientados y podríamos organizarlos en función de cuáles son los acompañamientos específicos que requieran los países.
Just a moment, please, because we have
Perdón.
no interpretation into English. I apologize.
Ok. Pensé que estaba hablando muy rápido.
Is
que
it
capaz-
better, the sound? Yes, I think it's better now. Thank you.
También voy a hablar más lento para no complicarlos tanto a los intérpretes. Me quedé en... tenemos que organizar y sería muy interesante que los encuentros regionales se pudieran organizar en función de temas específicos y que pudiésemos generar comunidades de aprendizaje entre los países, ¿no? Hay países que tienen un mayor desarrollo en un determinado ámbito de la prevención basada en evidencia, que sin duda podemos generar alianzas muy virtuosas para poder transitar y fortalecer la prevención basada en evidencia en las distintas regiones. Con Inga también estuvimos conversando y lo mencionaba, perdón, se me fue el nombre de nuestro anterior expositor, la importancia de la participación de las comunidades en las decisiones que tomemos respecto de la prevención, ¿no? Nada para nosotros sin nosotros, es posible transversalizarlo a todas las intervenciones que realizamos, ¿sí? Desde las intervenciones de prevención universal hasta eventualmente algunas intervenciones más específicas y especializadas sobre todo cuando hablamos de trabajar drogas específicas, ¿no? En general, nosotros cuando hablamos de prevención, hablamos de afectar factores protectores y disminuir factores de riesgo. Y eso pudiese parecer que es muy general, ¿no? Vamos a trabajar todos los factores protectores y vamos a disminuir todos los factores de riesgo. Pero tenemos que tener en consideración cuáles son los patrones de gestiones de riesgo y cuáles son los patrones de protección y de riesgo con determinadas situaciones y determinadas sustancias, ¿no? Y eso también es muy importante cuando tomamos las decisiones de ciertos programas basados en evidencia. Efectivamente, vamos a abordar factores protectores generales en todo sentido, sí, pero nos tenemos que dedicar también a mirar y a saber cómo vamos a prevenir ciertas conductas que pudiesen ser de riesgo y que pudiesen estar asociadas a sustancias más específicas, ¿no? Déjenme chequear mis apuntes con Inga, porque para que no se me vaya nada, creo que lo hemos planteado todo, la necesidad de tomar decisiones basadas en datos, pero esas decisiones no son solo al inicio y al final de las intervenciones. La necesidad de compartir con las comunidades también los resultados de las intervenciones. Y también situarnos como entidades, organismos, equipos profesionales que acompañamos trayectorias, en nuestro caso, trayectorias preventivas en la vida de las personas, ¿sí? No somos los expertos que venimos a decirles a las personas qué es lo que tienen que hacer. Manejamos un poco más de información, ¿no? Porque nos hemos formado conceptual y metodológicamente en eso, pero acompañamos trayectorias de vida. Y esas trayectorias de vida tienen que ser profundamente reflexionadas con las comunidades y alimentadas por análisis y estudios que podamos ir generando. Eso, Brian, y a los participantes. No sé si Camila querrá agregar algo que también hemos estado ahí conversando en las reuniones preparatorias.
Creo, Caro, que cubriste todo lo que hemos venido hablando con Ingadora y con todos.
Thank you. Thank you so much, Carol. My thanks to Ingadora, to Camila, and to all on the prevention side. Let me turn it next to sub-working group 3.2. I see Dr. Nicholas Priest is here with us. Thank you so much for joining us. Over to you.
Bonjour Brian, bonjour à tous. Merci beaucoup. Une nouvelle fois, je voudrais d'abord remercier les autorités américaines pour l'initiative que vous avez prise en 2023. Je voudrais aussi remercier tous ceux qui ont participé au travers de nos réunions et qui ont pu apporter à nos réflexions des éléments particulièrement intéressants qui nous amènent à clôturer cette année avec un certain nombre de pistes. Grâce à cette Global Coalition, nous avons davantage pris la mesure des enjeux, on a amélioré nos connaissances, on a partagé nos craintes, mais aussi nos espoirs et nos pistes de solutions. On a aussi vu tout l'intérêt de nous mobiliser ensemble. Je l'avais dit à Thessalonique, et je crois que tout le monde ici le partage, les drogues évidemment n'ont pas de frontières et les drogues de synthèse sont sans doute malheureusement l'avenir des drogues. À ce stade, au-delà des conclusions de notre groupe de travail, je voudrais insister sur 3 priorités qui me semblent incontournables et un principe d'action. La première priorité, c'est de créer les conditions pour débanaliser l'usage des drogues de synthèse, mais aussi l'usage des drogues en général dans la société. C'est aussi vrai pour le tabac et l'alcool. Dans mon pays, on aborde la question de la manière la plus globale possible, j'aime à le rappeler. Et ce n'est pas un point à négliger, car cette question est une question qui traverse toutes nos sociétés. Un effort pédagogique global doit être poursuivi, avec nuance, avec subtilité, pour convaincre le plus grand nombre qu'il faut jouer un rôle dans un tel processus, sans dramatisation, sans caricature. La deuxième priorité, elle a été abordée longuement dans nos travaux du groupe 2 comme du groupe 3, c'est de renforcer la prévention primaire en direction des enfants, en direction des adolescents et des groupes les plus vulnérables. Je suis convaincu que l'initiation et la poursuite de la consommation de drogue n'est pas un phénomène inéluctable sur lequel nous n'avons pas de pouvoir d'action. La troisième priorité est pour moi de lutter contre la stigmatisation des consommateurs dépendants, les protéger à court terme des complications les plus graves, comme les overdoses, et les aider à plus long terme à vaincre leur addiction et à trouver ou retrouver leur place dans nos sociétés. Le principe que je souhaite rappeler, c'est de nous baser sur la science. Beaucoup l'ont dit. Face à des questions qui sont souvent marquées par des représentations, des idéologies et des intérêts financiers. À travers nos rencontres mensuelles, nous avons mesuré que les initiatives fondées sur des preuves ou prometteuses existent partout. Certaines s'adressent à tous, d'autres à certaines populations, d'autres encore à certains milieux de vie. Nous baser sur la science signifie aussi que quand nous ne savons pas ou quand nous pensons détenir des solutions qui ne sont pas éprouvées, nous devons produire plus de connaissances grâce à la recherche et à l'évaluation. La deuxième année de la Global Coalition doit, selon moi, déboucher sur des réalisations désormais concrètes et opérationnelles. Des réalisations pour lesquelles nous pourrions faire plus et plus vite que les autres cadres internationaux existants. Certaines approches sont clairement envisagées car ce cadre global ne doit pas trop s'éloigner des réalités et des priorités de chacun. Mais l'important est désormais de délivrer des solutions à des problèmes précis, même si ces solutions sont partielles, voire modestes. Prenons le risque de choisir quelques priorités et de nous donner des objectifs précis, atteignables et à forte valeur ajoutée pour améliorer notre efficacité en matière de prévention, de réduction des risques et des dommages ou de traitement. Faut-il par exemple développer un programme mondial ou des programmes régionaux de mise à disposition de l'analoxone et des médicaments de substitution aux opiacés? Faut-il un programme de recherche encore plus ambitieux que ce qui existe pour la mise au point de traitements efficaces contre la dépendance aux stimulants? Devons-nous développer encore dans différentes langues et selon différentes approches culturelles de nouveaux outils de sensibilisation et de formation pour améliorer les connaissances des professionnels et la qualité des prises en charge? Voilà quelques exemples. Pour terminer, je me permets d'attirer votre attention sur 2 points. Nos choix seront aussi guidés par la question des coûts et de l'efficience de notre investissement. Nos ressources financières ne sont pas infinies. Nos politiques suivront d'autant plus nos propositions que nous aurons pris en compte cette dimension économique. Mais nous devons aussi envisager cette question des coûts et l'angle économique sous l'angle de la solidarité entre États et régions. À Thessalonique encore, j'avais pris l'exemple des mécanismes mondiaux de solidarité pour le financement de la recherche, de l'accès au traitement dans le domaine du VIH, de la tuberculose et du paludisme. Il me semble important de réfléchir, si nécessaire, à la mise en place de tels dispositifs. Cher Brian, en tout cas, et toutes et tous, je vous renouvelle encore tous mes remerciements. Ça a été une année riche, intense, intéressante. Et à très bientôt pour de nouvelles aventures.
Thank you so much, Dr. Priest. Very much appreciate your leadership and guidance over this past year. Now I want to turn it over to Dr. Yuri Cutipe from Peru, the other co-chair from Subworking Group 3.2 as well. Over to you, Yuri.
Muchas gracias, Brian. Buenas tardes o buenos días a todos los colegas que están participando, en especial a Nicolás, con quien hemos compartido el conducir, el facilitar este espacio de diálogo entre expertos de los países en estos últimos meses. Y reitero los agradecimientos también que Nicolás ha hecho a las diferentes personas e instituciones que han estado presentes en todo este proceso y que realmente ha generado un revuelo a nivel internacional respecto a la importancia que tiene este momento para poder hacer frente a no solo la amenaza, sino a una realidad que es que en muchos países las drogas sintéticas vienen ya constituyéndose en un problema de salud pública, ¿no? Solo quería complementar lo mencionado por Nicolás respecto a el tratamiento, los retos que tenemos que se han discutido en este espacio durante varios meses. Solo reforzar la necesidad que hay de fortalecer nuestra capacidad de respuesta, la capacidad de respuesta de nuestros servicios, de nuestras redes de servicios. Las drogas sintéticas, digamos, es un reto más para los servicios sanitarios, ¿no? Que se suma y que hace, obviamente, pone en evidencia también las debilidades que se viene arrastrando para la atención en general de las poblaciones que ya tienen problemas de salud por consumo de drogas. De modo que, digamos que esta amenaza significa también, genera la ventaja de dar una nueva mirada nuevamente a nuestros sistemas de salud, a nuestros servicios de salud o los servicios de atención para personas con problemas de consumo de drogas, ¿no? En ese sentido, pienso que, como también lo ha dicho Carolina, para el tema de prevención y ahora para el tratamiento, hay la necesidad como que de enfocar lo que venimos haciendo también mirando estas necesidades específicas de las poblaciones que empiezan a consumir drogas sintéticas, ¿no? Entonces, que tienen, digamos, retos, nos generan retos, como lo mencionado por Nicolás, de asegurar que los países puedan tener la disponibilidad de, especialmente de recursos estratégicos como son los medicamentos para el tratamiento de algunas de estas drogas sintéticas, ¿no? Como lo mencionado respecto a la naloxona, o, en fin, los medicamentos que se requieran. Pero también el tener estándares para el tratamiento de digamos, o el manejo de los problemas de salud específicos por drogas sintéticas. Creo que este esfuerzo podríamos también impulsarlo desde este grupo de trabajo, ¿no? El generar espacios o posibilidades o recursos que pueda hacer que se generen estos estándares específicos para el tratamiento, ¿no? En el caso de drogas sintéticas, especialmente las más prevalentes, y que esto posibilite hacer una revisión de las normas nacionales o de los estándares, no solamente respecto al manejo, sino a la perspectiva del tratamiento mirando a la recuperación, ¿no? Y que pueda en esto involucrar justamente a las personas que en su propio proyecto de retornar a la salud, involucrar a las poblaciones que sufren por estos problemas de consumo de drogas sintéticas. Y finalmente eso también nos lleva a pensar en las necesidades de financiamiento, como que lo hemos hablado varias veces. Como Nicolás ha mencionado, los recursos no son infinitos, menos en países de menor desarrollo económico, ¿no? Entonces, de modo que hay como la necesidad de fortalecer también la capacidad de respuesta de en salud, ¿no? O de tratamiento a las personas que consumen drogas. Y eso podría, digamos, impulsarse también desde este grupo, cómo es que puedan formarse como fondos rotatorios para fortalecer la capacidad de respuesta, de modo que los proveedores de servicios que en nuestros países, dadas las dificultades de los estados, están en manos de privados, puedan llegar a los estándares de calidad a través también del financiamiento rotatorio, ¿no? Entre países, de un fondo de financiamiento rotatorio que obviamente mejore la calidad de los servicios, ¿no? En fin, creo que son retos que desde este grupo y subgrupo podríamos también ir asumiendo, además de seguir intensivamente promoviendo o haciendo incidencia política en nuestros países y en los organismos supranacionales, ¿no? Para justamente generar estas nuevas oportunidades. Muchas gracias, Brian. Muchas gracias, Nicolás, y a todos los colegas, los compañeros, las compañeras que hemos estado acompañándonos durante este proceso.
Thank you so much. Very much appreciate it, Goody. Now I'm going to turn it to our next sub-working group co-chair. We're moving to 3.3. I understand Justice Henderson is not able to join us today, but we do have our other co-chair, Giovanna Calderon Altamirano from Costa Rica. Giovanna, over to you.
Muchísimas gracias, Brian. Muy buenos días y muy buenas tardes para todos y todas las que nos acompañan en esta sesión. Creo que hay que empezar, como lo han hecho los otros colegas, agradeciendo por este enorme trabajo que se ha venido realizando durante todo este periodo, y ese agradecimiento extenderlo a INL en la persona de Brian el día de hoy por su gran liderazgo y a todo el equipo de trabajo. De igual forma, a todos las y los copresidentes que han estado en esta ardua labor, a la CICAD por la oportunidad brindada de trabajar como copresidenta en este grupo en el marco de la coalición global durante este año. Y aquí debo detenerme a hacer una mención especial a Elisa Rubini, quien ha sido el soporte del juez Henderson y mío durante este arduo trabajo, porque sin duda ella es la que siempre está pendiente de que cumplamos con todo en tiempo y de que tengamos un subgrupo que va en línea con lo que se ha pedido en esta coalición. Lo que hemos avanzado tanto virtualmente como en el trabajo presencial que tuvimos en Grecia nos confirma que existe un compromiso y una voluntad de seguir adelante con la importante labor de la coalición. Se ha destacado la realidad con respecto a la situación de las drogas sintéticas en los diferentes países, y creo que esto es de resaltar porque a pesar de que los países tienen realidades diferentes, también hay algunas que son comunes, y esos patrones que son comunes son los que nos permiten tener una mejor colaboración con el intercambio de experiencias. En lo que se refiere a nuestro grupo de trabajo específico, el 3.3, que es dirigiéndose a las poblaciones en contacto con el sistema de justicia criminal, incluyendo alternativas al encarcelamiento, se ha dialogado bastante sobre los diferentes modelos y buenas prácticas desde los países que implementan estas iniciativas de alternatividad penal durante las diferentes etapas procesales. Lo hemos podido ver incluso desde antes de que se judicialicen los procesos, durante la etapa de judicialización e incluso ya en el cumplimiento de una pena. Y que definitivamente en cualquiera de estas etapas podemos intervenir y de una u otra forma generar prevención, sea desde la prevención primaria, secundaria o terciaria. Destacamos que desde este punto de vista internacional es beneficioso seguir compartiendo las buenas prácticas y también los desafíos en la implementación de estas, para ir mejorando, ajustando y afinando cada una de estas iniciativas. Y algo que es muy importante que mencionaba Brian en otro de los grupos, y es que tenemos que pasar de compartir, de analizar a la práctica, al poder implementar de una u otra forma esas iniciativas que otros países han tenido éxito y que en el de nosotros nos podrían permitir continuar con la alternativa al encarcelamiento, dando una lucha verdadera contra las drogas sintéticas. Por eso consideramos que es fundamental el continuar con este intercambio de buenas prácticas, como lo es con la iniciativa de la Red Internacional para Legislación sobre Drogas, que justamente se estará lanzando próximamente como una de las iniciativas de la coalición global. También con los espacios de diálogo a nivel regional y con el apoyo de la CICAD, queremos seguir impulsando un intercambio sobre alternativas al encarcelamiento, dando respuesta a las necesidades de las personas en conflicto con la ley por delitos relacionados con drogas y facilitando la conexión con servicios de tratamiento y integración social, como el modelo de gestión de casos y atención integral, que creo que es un modelo que también durante las sesiones de la coalición pudimos conocer bastante desde la práctica, desde donde ya se está implementando como tal y los buenos resultados que están basados en evidencia. Desde la perspectiva de Costa Rica, no puedo dejar de mencionar el trabajo que se realiza para los procedimientos de justicia restaurativa, que es un enfoque socioeducativo para apoyar de una manera integral la inserción social de las personas, tanto a nivel familiar como de su comunidad, y con eso, evidentemente, afectar de forma positiva todo el país. Esto se desarrolla, como me han escuchado en otras oportunidades, con la colaboración y la articulación interinstitucional entre el Instituto Costarricense sobre Drogas, que es nuestro rector en políticas de drogas a nivel nacional, y también con el Instituto sobre Alcoholismo y Farmacodependencia, que tal vez lo han escuchado más como IAFA, que es nuestro rector en materia de salud, y con la intervención desde la Oficina Rectora de Justicia Restaurativa, que yo represento, del Poder Judicial. Y también dentro de este programa aplicamos el enfoque diferenciado de género y también de niñez y adolescencia, que me parece que es indispensable cuando hablamos de alternativas al encarcelamiento, tener nuestra visión en las poblaciones en condición de vulnerabilidad y con ciertas condiciones especiales que requieren de una atención especial dentro de la integralidad que permiten estos programas. Por eso, reiteramos el compromiso desde la Oficina Rectora de Justicia Restaurativa del Poder Judicial de seguir aprendiendo en conjunto, de poder implementar nosotros nuevas prácticas, pero también de poder transferir este conocimiento y poder colaborar con aquellos que vayan por el camino, ¿verdad? O que consideren que este es un modelo que les puede funcionar, porque hemos podido a lo largo de estos más de 11 años empezar sin tener una legislación específica, pero con buenas prácticas basadas en evidencia, con evaluaciones, dando resultados, y creo que toda esa experiencia que hemos tenido, como siempre lo dice el magistrado de la Corte Suprema de Justicia a cargo del tema, está a disposición de quienes quieran continuar compartiendo con nosotros. Entonces, desde acá, desde nuestra parte, la disposición para seguir trabajando con todos los países para compartir las buenas prácticas, los desafíos en esta materia de alternativa al encarcelamiento, y lo más importante, porque creemos que con esto cambiamos las vidas de las personas y eso contribuye a un mejor mundo. Y ahora, si me lo permiten, voy a leer las palabras que nos dejó el juez Henderson, que no quería tampoco perder esta oportunidad. Y antes de eso, quiero dar una felicitación al juez Henderson por la recién promoción que ha tenido, y tengo el honor de presentarlo en su nuevo cargo como el honorable juez Henderson de la Corte de Apelación de Trinidad y Tobago, que es el rango más alto en su país en materia judicial. Entonces, extender esta felicitación y a continuación leo, abro comillas. Quisiera comenzar agradeciendo a mi colega copresidenta Giovanna Calderón, a la CICAD y a INL por todo el arduo trabajo. Ser el último en hablar tiene algunas ventajas y desventajas. Puede que piensen que ya he dicho mucho por parte de los copresidentes de otros grupos de trabajo. Sin embargo, hay puntos importantes que merecen ser validados y enfatizados. Destacamos varias veces la relevancia de la colaboración transversal entre los subgrupos de trabajo para abordar cuestiones de salud pública, pero también subrayamos la trascendencia de unir fuerzas con los grupos de trabajo del este y el oeste y ver a la coalición global como una. Hemos subrayado la importancia de continuar el impulso a nivel internacional, pero también es crucial que cada uno de nosotros y nosotras haga propio este legado en su trabajo diario a nivel nacional e internacional para seguir influyendo el espíritu y la urgencia de la coalición. Otra conclusión importante relacionada específicamente con la labor de nuestro grupo de trabajo 3 es la necesidad de ampliar la colaboración para fortalecer las instituciones y la capacidad de profesionales y del personal de apoyo en prevención, tratamiento, recuperación, integración social y alternativas al encarcelamiento. Se necesitan más esfuerzos para construir sistemas sólidos de monitoreo y evaluación que nos ayuden a generar evidencia tangible sobre lo que funciona, lo que podría expandirse a nivel nacional o replicarse en otros países y regiones. La evidencia también es crucial para persuadir a las personas que toman decisiones políticas a intervenir en prevención, tratamiento, rehabilitación alternativas al encarcelamiento e integración social, vinculado a este tema con la política de drogas y movilizando recursos para la implementación de programas. A nivel regional, gracias al apoyo de la CICAD, estamos planeando aumentar la cooperación entre los estados del Caribe que están demostrando interés en la capacitación y el desarrollo del modelo de gestión del caso y atención integral. En Trinidad y Tobago, fuimos pioneros iniciando en el 2020 y ahora estamos en el proceso de consolidar oficialmente el programa como parte de los servicios ofrecidos bajo la División de Servicios de Libertad Condicional del Ministerio de Seguridad Nacional. Conectando este programa con mi trabajo diario, más recientemente en mi calidad de juez, hice una derivación directa de uno de mis casos al programa. Estoy seguro de que esta persona recibirá todo el apoyo que podamos ofrecer para tener éxito y no regresar al sistema judicial en el futuro. Este es un ejemplo concreto que quería compartir con todos ustedes sobre cómo el trabajo de la coalición es significativo y relevante al conectar políticas y prácticas, gracias a la acción de cada uno de nosotros en su propia capacidad. Concluyo mi intervención agradeciendo nuevamente a todos y todas y con un caluroso saludo desde Trinidad y Tobago. Bueno, muchísimas gracias por el espacio que nos han dado a ambos para expresarnos en esta sesión del día de hoy. Brian.
Thank you so much, Giovanna and Justice Henderson. Those are wonderful words. I liked how you said that we are one coalition that unfortunately are stretched because of the time zone challenges that we find in our world. But if you are interested in seeing the other half of the discussion for this working group, you can join us in 13 hours when we have this meeting all over again with the next group. Now, I want to turn it over to the working group co-chairs, and I'd like to turn it over to Dr. Chris Jones from SAMHSA in the United States for his impressions as well. Thank you.
Thanks so much, Brian, and really appreciate the partnership with State Department and INL in helping to coordinate this. Thank you to all the members of the work group, and in particular, thanks to the sub-working group co-chairs. You made our jobs as overall co-chairs very, very easy because you were really leading the work among the subgroups. Just a couple of reflections as we think about what happens next and how do we continue to build on the momentum. I think first, for those of you who are able to participate in the previous Workgroup 2's discussion on sort of data and emerging threats, and this has been shared by some of the sub-working group co-chairs, is that there is a real need to sync that work. Surveillance in data are not simply for surveillance in data. They inform program, policy, how are we responding, are our efforts working? And so I think there is an opportunity to think about the efforts that may come from that and improving data sharing and information sharing and real-time identification of emerging substances. How does that get shared with the folks in this working group who are doing the work on the grounds, working in communities, working in policy to make sure that our policy is data-driven? So I think there's an opportunity for cross-collaboration there moving forward. I would also note that I think even across the three subgroups of this working group, there is a lot of opportunity for working together. And this is what naturally happens in communities. If you think about working with populations that have substance use disorders, people involved in the criminal justice system, sort of the downstream side of the working group, we know that if we can help people get into treatment, achieve recovery, that can be protective for the next generation. So that gets to the primary prevention perspective. We know parents who are incarcerated, people who are growing up in a home with parents that use substances or have a substance use disorder is a particularly strong risk factor for substance use for kids. So as we think about expanding treatment and recovery, it's not just for the individual that is struggling with substances, but it is also a benefit to individuals in the home as well as the community at large. And so I think moving away from thinking of, well, primary prevention sits over here, and then treatment and recovery sits over here, and harm reduction is over here. How do we recognize that we're all interdependent in our work in trying to achieve well-being, helping communities, individuals, and families thrive? So I think there's opportunities to continue to think about cross-collaboration, even within our working group. And in the US, like in many other countries around the world, we're in a very dynamic situation. The emergence of illicit fentanyl, methamphetamine, other synthetic drugs has really challenged how we think about our prevention work, our treatment work, our harm reduction efforts. And so it requires us to think in new and innovative ways. But it also requires us to learn from others. How are other countries navigating this experience? What can we learn from them? How can we share lessons learned for countries who are just starting to see synthetic drugs in their communities? What did we not get right? That might save you some time in not repeating mistakes that were made in the US. But the reality is that the risk of overdose and substance use related harms has never been higher, whether it's somebody using substances for the first time or somebody with a longstanding substance use disorder. And it just underscores the urgency of the collective work that we're all doing together. In the center where I work at SAMHSA, I lead the Center for Substance Abuse Prevention, and we've tried to take in our understanding of the epidemiology, the data, prevention science. We know that there is a foundation of evidence-based programs, policies, and practices. And we've prioritized 3 goals, which I think overlay nicely with this work group, which is preventing initiation of substance use in the first place, preventing progression of substance use to use disorders, and preventing and reducing harms. And so we are trying to operate in all of those areas, again, recognizing the interdependencies. So as we think about the work that moves forward, I think there is an opportunity, as the sub-working group 3.1 co-chair mentioned, and really thinking about not just at the individual level, but families, communities, the context that people are living. We call them social determinants of health in the US. Others might refer them as social drivers, but community context as a part of the prevention effort. If we are creating opportunities for education, opportunities for jobs, opportunities for stable food and housing, those can be part of the prevention approach to reducing risk for substance use. So we can really broaden the lens of partners that we work with in our prevention work. I think there is an opportunity to continue to focus in on the populations who are at the highest risk for harm. So those involved in the criminal justice system, individuals with substance use disorders. We've seen in the US context where when communities hone in on those higher risk populations, we can start to see population level changes in reducing overdose or overdose deaths. And so I think there's an opportunity to think about how do we continue to really focus where the risk and where the data tells us we can make the greatest impact, while also doing the upstream prevention work. I've noticed in all of the comments previous for this working group that there is a very strong desire to continue working together, to figure out what are mechanisms in which we can continue to share, a desire to engage virtually.
Podemos compartilhar desejo para maior engajamento.
We have Portuguese and English channel, please.
So continuing to work together to share best practices and learn. Again, I think there's an opportunity to build on things like the CHAMPS initiative that has rolled out as we think about sort of holistic approaches to prevention. How do we continue, as the last co-chair just talked about, engaging and thinking about alternatives in the criminal justice population, just recognizing the very high risk of that population. And really figuring out there's a lot that could be done. I think that's the big challenge in this space, is that there is much more that needs to be done than we have time to do. So continuing to think about how do we prioritize our work together? How do we continue to say this is an area that's really not explored well, and we need to dig into this and devote time to that. So just please know that certainly at SAMHSA and the U.S. Health and Human Services Department, we want to be partners in this effort, continuing to engage with countries to share the things that we've learned, to share resources and toolkits that we've developed, insights about what's happening in the U.S. context, what works in our context that might be applicable in others. But we're also keenly interested in learning from each of you to inform our efforts moving forward. So really appreciate all the work. I feel like this is the end, but also the beginning because there is much, much more work to do together, and have appreciated all of the monthly meetings over the last year and hearing the different presentations. It's very encouraging that despite these very complex, urgent challenges, there's a global community coming together to say, we've got evidence, we've got science, we've got data on our side, we can make a difference, and we can work together to advance that difference across the globe. So really appreciate it. Thank you. I'll turn it back to you, Brian.
Thank you, Chris. Very well said. Thank you very much for those comments. We have one more co-chair for Working Group 1. Hugo Gonzalez has been working with us. Now he's on travel, so he said he might tune in depending on what airport he's in, but I'll just pause for a moment to see if he's on. I didn't see him on the list. Hugo, are you with us? No. So in that case, I'm going to open it up for, we just have a few minutes left, 7 minutes left, but for any comments, reflections, discussions, ideas that the group has as we wrap up the Coalition West Group for a few minutes. Wadi, yes, over to you, please.
Thank you very much, Brian. And I just want to mention a few words on behalf of the Prevention, Treatment, and Rehabilitation section. Myself, Giovanna, and Anya, Milos, who was joining, big thanks to all the co-chairs, big thanks to you also, Brian, in terms of opening this, and for the chairs. On my behalf, given that I was implicated in 3.1, I would like to pass a message also to the co-chairs of 3.1, Carolina and Ingadora, for the great work they're doing and the great collaboration also with Camila and Mariano in terms of supporting the prevention thematic. But overall, on terms of PDRS, thank you very much for this opportunity. Of course, as United Nations, seeing a multilateral sort of movement addressing a specific problem that is global is something we cannot but applaud. In terms of systematic approach, we also kind of echo the message in terms of bringing all the different streams together. This response need to be multi-sectoral. As UNODC, we are moving to support this systematic approach because that's a different kind of technical assistance than technical assistance on one specific program. So maybe in the field of prevention through the CHAMPS initiative, through all treatment, through the Scale Up initiative, we're trying to move that systematic approach moving forward. Our international standards are at the disposal of all the member states. The UNODC WHO international standards are tools that are there, are available in terms of support. And our network of country and regional offices are also have their doors open for any sort of at least insight in the sense of what kind of support is needed, and we rely on the on this global coalition momentum to see how, as UNODC, we can approach at least the health response moving forward together. So thanks again, Brian, for this, and we look forward to further engagement in the next chapter.
Thank you, Wadi. And I, of course, also, in addition to thanking the co-chairs, have to thank the IO coordinators, including yourself, for all of the work, and Camila and others as well. So thank you, Elisa, I see on the screen as well, Mariano and others from the international organizations, Jose Luis. So I see George or Jorge has his hand raised. Over to you. George, feel free to take the floor. You're still muted. Or Jorge. Now you're unmuted, but we cannot hear you yet. No? Jorge, we're having some issues with your audio. Feel free to use the chat as well if you would like to type something in. We'll come back to you. Any other comments or questions while we wait for George? So if not, I'm going to say in the minutes that we have left, this is, I mean, all of the working groups are very important. All the sub-working groups are very important. This is one working group that has had tremendous interest, enthusiasm. There's a lot of architecture that has already been built around addressing substance use globally. And we've been working as partners for many years. One thing the coalition has done is to bring us closer together, more intensified in our discussions, in our consultations, to bring new partners on the line. If you're new and you haven't and you've missed some of the sessions, all of the sessions are recorded and they're available on our website. So please check that out. This coalition was able to create, to innovate, to look at where there have been gaps that are missing. In the prevention field around the world, we still have an issue of recruiting people that don't see themselves as prevention actors. And so that is something that we continuously, country by country, community by community, need to find ways to recruit the field, to train and mentor. We heard over and over again that there are tools, there's just curriculum, there are things that are missing, interventions they would like to have at their disposal. So the expansion of doing the prevention work in the field, doing evidence-based prevention, I think is critically important, and it will be something that we'll want to look at intensifying. Also, the innovation from UNODC on the CHAMPS, the systems approach, understanding and critically assessing, as we've been hearing, the REPS tool. There's new tools in our toolkit that we have to look at. So it's not just the intervention, it's the system and how we assess that. On the treatment side, we've created new networks, a global women's network, a global recovery network, just building on top of the global training and quality assurance work that we've done in the past. We have to intensify quality assurance for services that relate to treatment, to harm reduction work, expansion of harm reduction support services, and we need to find ways to better train that workforce. So the INL team will be looking at how we can expand and intensify and grow at scale the training initiative that we've been working on for some years. I think there's some new approaches that we're looking at that we'd like to consult with all of you on as next steps. And of course, alternatives to incarceration. Boy, there's been so many discussions. We launched a brand new organization, ACADI. I see Michelle there. There's a lot of enthusiasm, a lot of network, tremendous expertise from OAS CCAD, from UNODC, from Colombo Plan, all coming together to promote something that was agreed to at UNGAS. It's going to be 10 years soon from the last UNGAS session. But it's the time. It's the time for really an intensification of the work with ATI. And there's so much enthusiasm and so many criminal justice partners that want to intensify that work. So from the public health side, it's more than just stay tuned. It's start signing up for these initiatives as they start coming forward. The calendar that I mentioned earlier on the website will be the place that you can go to and connect to see specifically what activities will be taking place, what global coalition activities will be taking place, what other activities will be taking place that are in support of the coalition, but they're not coalition activities. Wherever you can participate, you'll start seeing registration links. And so that's a message as much for the international organizations that will be populating these opportunities as much as for all of you that should be consulting there. Our coalition email remained the same, syntheticscoalition@state.gov. You can continue checking in with us, but we do expect a lot of activity now in the weeks and months to come. So I will conclude this session by thanking you all once again, saying that we will be following up with email communication. We will be continuing to expand participation in the coalition. If you have other colleagues in countries that haven't been able to participate, as we move into the operational phase, this is the time for us to start working and taking action. Thanks to all of the work that you've now done in helping us understand the issue better and frame the solutions going forward. Thank you all so much. Take care, everybody, and see you soon. Goodbye.